Done?
Gone.
In progress.
Good evening, everyone. Welcome to Fever Foundation quiz program, Fever Fizz. And very thankful to you for having joined this program. So before we actually play the quiz, I am going to show it to you all the rules of this game. What are the rules through which we are going to play this game? And then how it has to be played, and there will be a trial round of 3 questions so that you become familiar with us. And before doing so, I'm just going to explain to you the rules. The basic rules of the games are the quiz is only for postgraduate students only. The quiz consists of a multiple choice questionnaire. The option to be selected by clicking on the button on the text panel. So if you will be seeing the question, but they are just for the representative purpose only. Please use the text box next to you, next to this video, and then you have to use that for selecting the answer. And I request all the participants not to leave this platform and enter the YouTube. See, we are going live on the YouTube. That is only for viewing. You cannot answer any question. You cannot play the quiz there. All the participants requested to stay on the platform and not to go into the YouTube channel. So all entire program and the quiz, please be on the platform itself. And once you submit the questions, you will not be possible to revert it. So please be cautious when you are submitting, and no negative markings in this game. The winner will be the maximum fastest right answers. Who answers fast and the right will be the winner. And if there is a tie, there will be a tiebreaker round. There will be 3 questions which will be done by our judges, and the winner of this round will be decided as the winner of the quiz. And also, we request you to use the laptop or desktop for a better experience, and you should also have a proper internet connectivity in your room so that your internet is fast enough to support you. And also, if our judges find any type of foul play, your registration will be automatically disqualified. I'm requesting all of you should not use the mobile phone for getting the answer from any of your colleagues or sitting nearby. And Fever Foundation is not responsible for any form of technical error such as poor connectivity, etc. And participation in the quiz implies that the participant accepts all the integrity of the rules. And the participants who have given incomplete or inaccurate personal or contact details will be disqualified. And non-compliance with the rules results in automatic cancellation of a participation in the quiz and of the candidature of the prize. And one more important thing, the first and second winner from each zone will be selected, and they will be playing as a team in the national level competition, which is called FEFCON 2022 in November 2022. And ultimately, whatever dispute, anything happens, our quiz masters and the judges' decision is final, and you all have to be abide by this rule. So these are the rules. And once again, wishing you all good luck, and may the best person win the game. And I would like to introduce our judges for this game quiz. One is none other than Dr. Jagdish Channappa sir, whom all of you will be knowing. He's a cluster head of pediatrics at Manipal Group of Hospital, Bangalore. And he's the past president and respiratory chapter, Indian Academy of Pediatrics. And he is CEO of Bangalore Medtrain Learning LLP and consultant Child Central Bangalore. He's involved in teaching undergraduate medical student and postgraduate student as well as paramedic nurses. Then he is the president of IAP BPS 2007 and examiner for MD from 2007 onwards. He's organized several conferences, organizing chairperson of Respicon 2017 to name one. And he is a certified pediatric bioethics from Mercy Children's Hospital, Kansas in 2015, certified by the Karnataka Medical Council and Mumbai Medical Council, Hospital Ethics Committee Committee, Manipal Hospital, 2012-13 and 2019 onwards. He is in the Immunization Subcommittee of IEP 2007, and he is also part of the Karnataka Government COVID-19 Pediatric Task Force. So welcome Dr. Jagdish Channappa sir to the program as judge. Then we have the second judge is Madam Dr. Rachna Das Hazarika, whom all of you again will be knowing, in fact, personally. Madam is also a consultant pediatrician. Can I have the slide, Krishna? Yeah. Madam is MD Pediatrics from PGI Chandigarh. She has a special training in Pediatric Emergency and Intensive Care Unit, Chandigarh. And areas of interest include Pediatric Intensive Care and Emergency, Pediatric Infectious and Respiratory Disease, and Pediatric Rheumatology. He has several awards and accolades, to name a few. She has established Department of Pediatrics in Shillong in 2005, designed and supervised the entire construction of the PICU in the government hospital in northeast of India and made it functional from 2007 March onwards. And also she has helped designing MBBS syllabus for NIGRIMS in 2008, published more than 50 papers in various national, international, and the regional journal, index journals in PubMed, Biomed Central, and she's written several chapters in the book. Here she's been a research worker. She's done a lot of research, conducted a number of multicentric projects and Indian Council of Medical Research and the International Clinical Epidemiology Network. And she has been several administrative responsibility, which includes IAP Meghalaya editor, secretary IAP Guwahati, secretary IAP Assam, and she's also been the editor of Breeze newsletter of IAP Guwahati branch, and she's the chairperson of Scientific East Zone Academy of Pediatric in 2022, and she has been the member of Task Force of Government of India on COVID-19 preparedness for children. Madam, Rachna Madam, welcome to this program. With this, may I now request Dr. Jagdish Channappa sir and Rachna Das Madam to take over and conduct the quiz. Over to you, sir. Thank you very much. Best of luck to all the participants again.
Thank you.
Thank you. Dr. Rachna can go ahead.
Yes. So I think I'll ask our event management, the computer G, to actually show us the first three questions, which will be the ones by which you will practice. So the rest of the quiz, when we conduct it, it will be followed in this pattern only. Can we have the first slide? So the first question, very nice, one of my favorite movies. Who is the director of the movie Sholay? We have A. Ramesh Sippy, B. Ayan Mukherjee, C. Rajkumar Hirani, and D. Yash Chopra. So your time starts now. So I think the answer is very easy, but let's see how many people have got this correct. So could you display the correct answer? Okay. So
Sholay was one of the favorite movies for all of us, ma'am. Sholay. So, yeah.
Many times.
Please participate once again. I'm reiterating it. These are the dummy questions for you to participate. So no marks will be given. We just have to see that who is. Okay, ma'am, now.
Yeah. So are we going to have the answers also displayed? How many of them got it correct? So that they also get an idea?
Yeah, that can also be done.
I don't know how many of the new generation people have seen Sholay.
Yeah, ma'am.
Wow, they got it right. 87%.
Almost.
Not bad. But still some 8% got it wrong. Fine, no problem. So we'll go for the next question. Can we have the next question, please? Guess the name of this Tollywood actor. So A. Naga, B. Akhil Akineni, C. Ram Charan, and D. Allu Arjun. I'm sure all of you are going to get it right. The time starts now. So even I don't know this answer. I don't watch Tollywood, but I think if I ask my husband, he will tell me.
No, Dr. Jagdish Channappa should answer this. Sir.
I most definitely will not know this. So I will pass.
Not our generation. This is not absolutely not our generation.
No passing.
No passing.
I go with B.
No passing and no negative marking.
I will guess as B. Akhil.
B. Yeah, I go with B too.
Yeah. So let's see what's the correct answer. Our guesswork is good. So, the 66% have also answered it correct. That's really nice. So this is the way we are going to do the pattern. So we'll have one more practice question. Next one, please. What is the full form of IMDb? Internet Movie Database, India Movie Database, Internet Move Database, or Indian Mass Database? Your time starts now. Dr. Jagdish?
Yes, my answer is A.
A. That seems the most logical, no? So can we have the right answer displayed? That's for experience. Okay, so let's have the correct. How many have given a correct answer? Oh, this is like absolutely 100%. Okay, so I think all our participants have got an idea of how we are going to go about it. And only thing I wanted to ask is, Dr. Manjula, are we going to display the fastest person even at the end of the results?
Yes, ma'am. Yes, ma'am.
Okay. So we are going to display the people who have answered the percentage of people who have answered the correct, given the correct answer, and also the person who has been the fastest.
Yes. Yes.
Right. So it will be an instant kind of a results for the participants. So I think everybody is geared up now. So Dr. Jagdish will start the main quiz.
Yes, ma'am. Please. Oh, the floor is yours.
Thank you. So let's start with the Fever Foundation quiz for postgraduates for pediatrics. And the Eastern region is the first to participate. So I wish you all the best. We have quite a number of registrations for this. So can I have the first question? The rectal temperature is greater than the oral temperature by how many degrees? A, 0.2, B, 0.4, C, 0.6, and D, 0.8. Your time starts now. So I think this must have been quite easy as an opening question. Can we have the correct answer displayed? So it's 0.4 degrees more than the oral temperature. And can we have the results? So usually the temperature keeps on varying, no? When we take, even in the morning, temperature is different from the evening temperature, and temperature is also dependent on the ambient temperature. Though we don't use rectal temperature very frequently in clinical practice, but this is something we must know. Whenever we want to see the core temperature, I think the rectal temperature is the method of choice. So if the results are ready, can we have them displayed?
Yeah. Jagdish sir, you want to say anything? This. Yeah, the results have come. Yeah.
So the correct answer is B, and 52% have got it correct, which is good. So I hope after this, all the ones who are participating will know that it is 0.4 degrees centigrade higher. Dr. Jagdish, you want to add something in this? I mean, how frequently do...
No, ma'am. No, ma'am. I think the important thing to emphasize is there is variation in temperature from different parts of the body. The surface temperature generally will be lower than the core temperature, and the rectal temperature will be higher than the oral temperature. That is the main thing that we need to look at. And of course, there will be more questions in, may not be in this session, but on how to look at core temperature. So I think that's important. And other thing also to emphasize is, as Madam mentioned, rectal temperatures and oral temperatures are not often taken because of the inconvenience of taking them and the chances of doing harm to the child while taking them. And as you all know very well, the mercury thermometers, which we used to use for rectal temperature measurements, are no more available. So and are out of market because of the banning of mercury in instruments.
So if you can have the fastest answer was given by which person? Wow, Manjuri Basu. She took only 6 seconds to answer this question. Congratulations. So let us go to the next question. In fever without focus, the duration of fever, which lasts for more than how many days, is termed as PUO, or pyrexia of unknown origin. A, 7 days, B, 10 days, C, 14 days, and D, 21 days. Your time starts now. So I think this should be an easy one again. But let's look at the correct answer. Kindly display the correct answer for the benefit of the students. So the correct answer is 7 days. For this, I think when we started off during my MBBS days, the definition of PO has really changed, because initially it used to be 3 weeks, and then you have to do extensive investigations. And after that, Harrison used to tell us that, at least a fever duration of 3 weeks was necessary to term it as PO. But gradually, as investigations became available, and we had many things which could be, given to us within a few hours, the results of investigations. Now they say that 7 days, if you do not have any investigations done, and if investigations are done, then even 3 days of fever can be, where you have not established a diagnosis with all the available laboratory methods, then you can call it as PUO. So Dr. Jagdish, anything else you want to add in this PUO?
I think you have hit the nail on the head. It all depends on the rapidity which you get results. In the olden days, we used to take culture reports, which used to take days to get. But today, with the available of BACTEC and other modalities, we can get the answers pretty fast. And therefore, PUO generally, the duration is reducing as the time goes by, and 7 days is probably the right way to look at it. Can we see the correct answer, please?
Yes. And can we get the results? Oh, so 19% have got A, and the rest are still stuck to our old definition of fever, I think. So I hope that after this, you will modify your knowledge and say that it's more than 7 days. So there are different types of POs also. And with the malignancies, you have the fever which comes in the hospital. And there are lots of other diseases where you can get really recurrent fevers. But one thing which is very interesting and was mentioned in Harrison, and I remember it, that the longer the duration of fever, the less is the infective cause. And the non-infective causes become more plausible. So can we have who is the person who has answered? Dr. Naveen Kumar, only 4 seconds. Wow, even faster than the last one. That's very good. Congratulations. Can we go to the next question, please? Blue fever is associated with A, Rocky Mountain spotted fever, B, enteroviral infection, C, secondary syphilis, and D, West Nile virus infection. The time starts now. Okay. So the blue fever is really like blue, like our background of the question. Can we have the correct answer displayed, please? So the correct answer is Rocky Mountain spotted fever. It is also known by a variety of other names like Brazilian spotted fever, Tobia fever, Sao Paulo fever, and whatnot. So I'm not very sure why it is called blue fever, Dr. Jagdish. Do you have any idea?
Primarily because of in the olden days there was hemorrhages and increased rash. So probably that is the reason why it was called as a blue fever.
Blue fever. So can we have the results? So, okay, 47% have got it correct. And an equal number, about 45%, have gone for D. So I think this was 50-50. 50% of the people knew and 50% didn't know. So who is the one who has got it the fastest? Ditanu Chakrabarti. Oh, 3 seconds. These students are getting better and better with the questions. Nice. Congratulations. Then we go to the next question. High fever during the first trimester of pregnancy has been associated with which of the following conditions? A, teratogenic effects in animals. B, no causal relationships in humans. C, definitive abnormalities of the central nervous system in humans. And D, skeletal abnormalities in humans. Your time starts now. Okay, so I think generally we know that fever is not good in pregnancy. So let us see what is the correct answer for this question. Can you display the correct answer, please? Yeah. So teratogenic effects in animals. This is very, very important because from the point of history taking, whenever we have abnormal babies being delivered, I think this is one of the few things that we ask the mothers whether they had any fever during any time of the pregnancy. And during the first trimester, it is important because it could be because of the torch-related group of infections also, where you get a lot of abnormalities in babies, and sometimes, most of the times, they will be abortus. And fever itself leads to teratogenic effects in the animals. So this is again a very important information. Anything else you want to add?
Yeah, I think the important thing to realize is that though high fever during the first trimester of pregnancy has been shown to be teratogenic in animals, this relationship is not yet clearly established in human beings. There are some reports of increased incidence of CNS abnormalities, skeletal abnormalities, but a large study did not show that there was a one-to-one correlation. But there is some causality of teratogenicity. So that is why still it is under investigation and not proven. So what is definite is that teratogenic effects happen in animals. In human beings, we do not know.
So can we have the percentage of people who answered it correct? Oh, only 27%. The others, it was equally divided. So I think this was a good question in the sense that it made people think. But as Dr. Jagdish said, that this is still not established in human beings, but still normal after being born. So do we know who is the first person who answered this correct? So again, Dr. Naveen Kumar, correct. So congratulations. 6 seconds to answer this. So this is really good. I think, which of the statements is incorrect? So here I would ask the participants to please understand that you have to tick on the incorrect statement regarding warning signs of primary immune deficiency. So which means out of the 4 choices, 3 are correct and 1 is incorrect, and that is the one you have to tick. So A is 2 or more episodes of pyoderma within the first year or within 1 year, 10 or more ear infections in a year, failure to thrive, 2 or more deep-seated infections. Your time starts now. So primary immune deficiencies are actually defined by a set of 10 red, as a clinician should remember. So before I tell you which is the, before we look at what are the 10 points, I think let us look at what is the correct answer, or the one that we wanted, the incorrect warning sign of primary immune deficiency. Can you display the answer, please? Can you please tell us what is the correct answer here in this question? So the correct answer here, that means the one which is incorrect for primary immune deficiency, is 2 or more episodes of pyoderma within 1 year. This is because this is a superficial infection, and people have, this cannot be a sign of primary immune deficiency because of the exposure of people to various organisms. And the skin is one of the first line of defense. And therefore, the ones which are 10 or more ear infections is the correct answer, because if you look at the definition, you should not have more than 4 ear infections in a year. Failure to thrive, because these patients have repeated infections and they cannot gain weight properly. 2 or more deep-seated infection. If you have a good immune system which is functioning, you should not have 2 or more deep-seated infections or abscesses. Also, if you have more than 2 pneumonias per year, or more than 2 months of antibiotics have been used without any effective therapy or response of the person. Again, the fungal infections, that means oral thrush or persistent oral thrush. Oral thrush can be happening in small babies. We do see them commonly, but if they persist and they do not respond to your usual therapy, then again, it is an indicator of a primary immune deficiency. Sir, you would like to add something to this?
Yeah, for students, I think the important thing is Dr. Andrew Bush has a very nice mnemonic to remember. It's called SPUR. So if you have a severe infection, a persistent infection, an unusual infection, or a recurrent infection, in any of these 4 conditions, if you look at in a child, these are indicators of a probable immune deficiency. So in this child, for example, episodes of pyoderma is quite common in our children because of the socio-economic and unhygienic state in which they live. Failure to thrive means that the infection is pretty severe. 10 or more ear infections definitely is abnormal, and deep-seated infections means these are severe infections which have no business to be there in a immunocompetent host. So therefore, the best answer is 2 or more episodes of pyoderma within a year.
Thank you, sir. Can we have the results? So most of the people have answered as the ear infection, which is 48%, which is not correct. And the correct answer has been only given by 25%. Can we see who is the one who is given fastest? Biplab Tudu. Okay, 3 seconds. They're getting better and better, sir, with the questions. So we'll go to the next one.
I think the next time they might answer the question even before the question comes on.
But the answer will not be accepted if they answer before the question finishes. So that the students must note. Can we have the next question, please? Okay. Drug fever is characterized by all of the following except. So again, you have to give the correct answer for the one which is not correct. Temporal elevation of the temperature soon after drug administration. B, prompt disappearance of fever after discontinuation of the drug, usually within 24 hours. Physical and laboratory investigations are non-contributory, usually associated with relative bradycardia. So you have to find out which is not true. So your time starts now. Okay, so sometimes you do get foxed by these drug fevers in the clinical practice. Let us look at what is the correct answer. Can we have the correct answer displayed? So temporal elevation of the temperature soon after drug administration is the correct answer, because it is said that drug fever does not have any specific pattern of appearance. It's not like that you give the drug and within 2-3 hours, the fever can occur. Even books say that it can occur even after a few days or few weeks. So therefore, this is the wrong answer. However, the others, that it is correct that once you stop the drug, you find that the fever totally disappears. And physical and laboratory investigations obviously would be non-contributory, because this is not an infection. This is a response, an immune response to a drug. And usually with other fevers, what happens, the body responds by elevating the temperature, as well as there is change in the heart rate. So here there will be relative bradycardia. There are many drugs. Sir, would you like to tell us about the common drugs which, in the clinical practice, some antibiotics also cause drug fever?
I think the main culprits in practice would be into 2 groups of things. One is it could be an antibiotic, especially the beta-lactams and the cephalosporins, which are very notorious for producing drug fevers. The other thing which you need to look at are anticonvulsants. So you need to look at these 2 groups of drugs primarily, but remember that any drug can do it. So it's not as if that it's only restricted to these, but the commonest ones, if you look at, are basically antibiotics and mainly the beta-lactams and the anticonvulsants.
So can we have the answers, please? Sometimes these drug fevers really create headache for the clinician. And you really don't know whether you should stop the antibiotic. Oh, so people have taken choice number 4.
Bradycardia.
Bradycardia. No, that is what happens when in drug fever, you get fever, but you don't get elevated heart rate. So that's a correct answer. So the first one, that is, it is not related, there is no pattern, is the correct answer. So let us see, and I think this is a very good question for them. It will help them in their clinical practice. So let's see who got it first. So Dr. Chandra Mohan SK, 7 seconds to answer.
I think he took a little time to think about it.
Yes. I think this was a foxy question. So very good. Congratulations. You've got it correct and very fast. Can we have next question, please? Posterior cervical lymphadenopathy, fever and rash is seen in which infection? A, mumps, B, measles, C, rubella, and D, Epstein-Barr virus. Your time starts now. I think this is like one of the questions which we used to prepare for postgraduate entrance, where you had to know that some infections have particular predilection for some group of lymph nodes. So can we have the correct answer, please? So rubella, and I'm sure all of you must be knowing it, that rubella is one of them, which causes posterior cervical lymphadenopathy. It can also cause occipital lymphadenopathy, and it is said that mostly it is most severe. The lymphadenopathy is most severe during the rash, but that is not always, like you don't have to have rash for the lymphadenopathy. So, Dr. Jagdish, anything else you want to add with rubella? Very debilitating, actually, once you have it.
Yes, I think we don't see much of it now after vaccination.
Yes.
So I think the important thing is that only you see rubella mainly in adolescents. And if an adolescent comes to you with this kind of a fever and a short duration of fever with a rash and a posterior cervical lymphadenopathy, then rubella should be suspected.
Right. So can we have the answers, please? Actually, I think especially after the MR vaccination campaign, this is really improved. So, okay, 46% have gone for EBV, but I think EBV is mostly in the anterior group, and 31% have only gone for rubella. So let's see who is the one who's got it correct the fastest. Anisha Chaudhary, very nice, 4 seconds, very good. So can we go to the next question, please? So look at the picture and you will see that this is something known as a Herald patch. And this is characteristic of which of the following diseases? A, HHV7 or human herpes virus 7, B, chicken pox, C, parvovirus B19 infection, and D, dengue fever. Your time starts now. So can we have the correct answer displayed? So this is human herpes virus 7. Usually this kind of a rash can occur in the face, in the back, in the chest, and abdomen. I think very difficult to see in dark-skinned individuals. And they are characterized by fever with headache along with the fatigue and the rash. Sir, have you seen any? Because I haven't seen any in my practice till now.
Yes, difficult to prove, but usually this kind of Herald patch is the first to come, and then you get subsequent rash. And it's a peculiar tendency of this particular virus to attach to CD4 cells in the skin and in the epithelial surfaces. Rarely you can get HHV7 causing encephalitis. So I think we need to keep a watch on that. Not commonly seen, but if it comes up, you definitely should pick it up. Especially if you have a child who comes to you with high fever, headache, rash coming on, this kind of a rash coming on, and then having a bit of disorientation, the first thing you should look at is HHV7.
Yes. Sometimes you get similar rashes also in fungal infections, but the difference is that in that you'll get, along with this, you will get satellite lesions occurring nearby the main patch. So that is how we differentiate between that from human herpes virus and that from fungus. So let us see how many of the students have got it correct. Can you please display the answers? Okay, 70%, sir, have got it correct. And I think they've really prepared well for their PG entrance. So let us see who is the fastest among these 70% correct answers. So Dr. Biplab Tudu again, 2 seconds. Wow, great. So let us now go to the next question. I think we're doing great. The next question, relatively easy, I think. India ink preparation is used to identify which organism? A, Cryptococcus, B, Histoplasma, C, Streptococcus species, and D, Salmonella. Your time starts now. So I think this has been relatively an easy question. Can we have the answer displayed, please?
I expect 100%.
Yes, yes, me too. So among, yes, Cryptococcus. I think this is what we've been taught right from our MBBS days. I have seen once or twice children with HIV, where we did the CSF because of meningitis, we did find a positive India ink preparation. So this is a very nice way to know whether your patient is having cryptococcal meningitis. So can we have a look at how many people have got it correct? So mostly, I think in immunocompromised individuals, this is something that we must suspect.
In days gone by, we used to do this India ink preparation when you're suspecting tuberculous meningitis.
Yeah.
So to rule out, good, 88%, not bad. That was very good. So let's see.
88%, yes. Let's see who's the fastest finger. Anirudh Neeli, 2 seconds. Wow. Then I think gradually they will reply it within, half a second. That's really great. Thank you. Let us go to
fabulous.
Fabulous, I think. Very good. Let us go to the next question, please. Terminal complement deficiencies are at a higher risk of infections due to which organism? A, tuberculosis, B, encapsulated organisms, C, staphylococci, and D, Klebsiella. Your time starts now. Okay, so let us see what is the correct answer. I am sure this also people should have got it correct. So the correct answer is encapsulated organisms. Sir, would you like to add anything for the complement deficiencies, how common it is?
So I think it's important to know that there are different types of complement deficiencies, and some of them are can come with tendency to infection with encapsulated organism like like Neisseria meningococcus and pneumococcus. So you have to be careful in these patients, especially when you see a child with fulminating meningococcemia. There is a possibility that this patient has got a immunodeficiency. So therefore, it needs to be evaluated there. We also know that some of the complement issues can also come with urticaria and recurrent angioedema. So those are also other things that they can come up with. And of course, there are many other complement abnormalities with various degrees of immunodeficiency to various organisms. So in this particular terminal complement deficiencies, we have encapsulated organisms as a primary problem.
So any of these serious infections, we must always keep this in mind. So can we have the answers displayed, please? Wow, 82%, not bad. So this is really encouraging to see most of you getting it correct. Can we have the fastest one, fastest finger first? Anirudh Neely again, and only 3 seconds. These students are really good. Sir, what do you say?
Yeah, absolutely. I think the Eastern zone has got really good teachers, I must say.
Looks like. Okay. Great. So can we go to the next question?
We are halfway, Rashna. It seems to be very good. Huh?
Yeah, we are halfway. It's really going well. So the next question is, fever with atypical lymphocytes are seen in Epstein-Barr virus, cytomegalovirus, toxoplasmosis, or in all of them. So A, B, C, or D, all of the above. Your time starts now. Okay, so all of them are viral infections, and I think we should have people giving the correct answer. So can you display the correct answer, please? So all of them are correct. It can be found in EBV, CMV, as well as toxoplasmosis. Sir, would you like to say why this is common, the atypical lymphocyte?
So basically, these are all seen in viral infections, in toxoplasmosis, which is not a viral infection. We also see it in mismatched transfusion. We also see it in for various other in transplantation. So atypical lymphocytes only mean that during the process of lymphopoiesis, there is an infection which takes place and changes the morphology of these lymphocytes. So that's the reason you see them. And the percentage is what is also very peculiarly seen. For example, if you look at all these three, the EBV will have the maximum number of atypical lymphocytes because it's a kind of a systemic viral infection, which is quite dramatic. CMV, on the other hand, is a relatively indolent kind of infection. Toxoplasmosis also is indolent. So we'll have to really look for those atypical lymphocytes. Whereas with EBV, they are obvious. So these are some of the differences between what you can see.
Great. So can we have the answers displayed? Wow. So everybody guessed all 67. So this is really nice. Let us look at who was the fastest among the 67% population. Bhavani Singh, and she took on, and Dr. Bhavani took only about 3 seconds to answer it. So not bad. I think we are going great. So can we move on to the next question, please? Lethal toxic encephalopathy due to Shigella is also called A, Ikari syndrome, B, atypical febrile convulsion, C, meningitis, and D, none of the above. Your time starts now. So let us look at what is the correct answer. So it's Ikari syndrome, and I think this is due to an acute neurological deterioration, which occurs because of the enterobacterial infections, most commonly with Shigella. And there is a thrombi development, which leads on to local inflammation and therefore the encephalopathy, and along with a dysfunctional blood-brain barrier. And the only highlight of this is that it has a very high mortality. So in any diarrhea patients, if you have encephalopathy, we must suspect the organism to be Shigella. Sir, have you seen any recent cases Shigella? We don't see these so much these days?
Yeah, we have seen in the past, but as I agree with you that we don't see it these days. But I think it comes in particular, groups of patients, in cohorts of patients. So it's probably not that common now with more better hygiene this thing. But we do see occasionally a patient who comes to with diarrhea and seizures, and we are always worried about this syndrome. Especially if the child comes to you with blood and mucus in the stool, then you're almost worried about a child getting seizures and progressive. This is a rare condition, but it's a rapidly progressive and usually fatal condition, which is not often seen, but we need to keep it in mind.
Yes. So can we have the answers? Let's see how many of them got. Oh, 88%. Again, I think very well prepared students. So let us see at how many, who was the fastest in answering this? Naveen Kumar. Okay, Naveen Kumar again. So time taken to answer 5 seconds. Not bad, sir. I thought this was a very tough question, but I think the students are managing it very well. So can we go to the next question? Question number 13. Episodic or sporadic episodes of thoracic pain due to myositis of the abdomen or chest is caused by Coxsackie B, is known as Bornholm disease, epidemic pleurodynia, Gianotti-Crosty syndrome, or D, both A and B. Your time starts now. So let us look at what is the correct answer for this question. So both it is known as both Bornholm disease or epidemic pleurodynia because of the involvement of the abdomen or chest muscles. And I think it is not only caused by Coxsackie B, it can also be caused by Coxsackie A and a lot of other ecoviruses. So it's very, very painful they say it's extreme pain occurs in this condition and very difficult to even control with anti-inflammatory agents. So how commonly do you see this?
Well, getting muscle pain due to a viral infection is not uncommon. In fact, we see a lot of them in the calf muscles, and usually these are influenza related or dengue related muscle pain. But the peculiarity about the Coxsackie B and A is the very severe chest pain that comes along with the viral infection. We don't do viral studies, so we don't know the true incidence of Coxsackie B or A, but chest pain with viral infections is not uncommon, and we see them quite often. So sometimes we start looking whether this is related to a pericardial infarction, a carditis, or even gastritis with a reflux happening over there. But many of them
or a pleuritis, yeah.
Pleuritis, yeah. So in fact, I have a patient right now who's got a bit of a pericarditis and severe chest pain. So again, it's a viral infection. So we really need to keep a watch on this. We normally don't investigate. And just for information, Gianotti-Crosty is papillary acrodermatitis, which you see in small children. And previously, it was thought to be related to hepatitis B, but now any virus or even a kind of a reaction to chemicals and other things can produce a papillary urticaria in small children.
So this is something we should keep in mind. Next, can we have the answers displayed? So 55% have got it correct. So let us see who has given the fastest answer for this question. Dr. Abhin S. and time taken to answer is 5 seconds. Very good. So we'll go to question number 14 now. Mulch pneumonitis is associated with which primary immunodeficiency disease? A, chronic granulomatous disease, B, acute complications of sarcoidosis, C, chronic mucocutaneous candidiasis, D, none of the above. Your time starts now. So let us see which is the correct answer. So the correct answer is chronic granulomatous disease. Here, what is said is that because in chronic granulomatous disease, there is a defect in the NADPH oxidase enzyme. And actually, this enzyme is responsible for killing of certain bacteria and fungi. So if a patient with a CGD or a chronic granulomatous disease suddenly inhales a huge amount of fungus, then it leads to something which is known as mulch pneumonitis. I haven't seen any patient of CGD with fungal pneumonitis as yet. Sir, have you had the opportunity to treat such?
We have had quite a few patients with CGD. Most of them have a chronic issue, but as Madam mentioned, this acute inhalation of fungus is not a very common thing in our country. Usually, these are soil fungi, and they can spread very fast and create a total fulminant pneumonitis, and that's why it is called as a mulch pneumonitis. Not seen a mulch pneumonitis, but I've seen various other pulmonary manifestations of CGD.
So usually they will, the fungal infections are more said to be more common when you are working with soil. So it is more common farmers. But in India, if you have pigeons living near your house or near the house of the patient, then of course you can inhale the fungus from the pigeon stool also. So sometimes I remember we had one patient in the dialysis unit who repeatedly, many patients were getting fungal infections. And they found the source to be the pigeon, which was having a habitat just outside on top of the air conditioning unit. So can we have the answers displayed? Let us see how many of you got it correct. So 67% have got it correct, which is really nice. And who is the fastest among the 67%? So Vivek Ahantam. Okay, so he took about 5 seconds. Great. So can we go to the next question, please? Question number 15. So what is the maximum daily dose of paracetamol? Is it 35 mg per kg per day? B, 55 mg per kg per day? C, 75 mg per kg per day? Or D, 100 mg per kg per day? Your time starts now. So we all know that paracetamol is the drug of choice for control of fever and even for mild painful conditions. And most of us would be using at a dose of 10 to 15 milligram per kg per day. So, but then we can even go up very high. So let us look at what is the correct answer. Can we display the correct answer, please? So we can go up to 100 milligram per kg per day, and any dose above this would be toxic to the liver. So I never used such high doses ever in my life, sir. In which, have you ever used it in any condition, Dr. Jagdish?
Yeah, so the recommended dosages are 15 milligram per kg per dose. And these can be repeated at a minimum interval of 4 hours. So if you give 6 doses, then you would probably reach 90 milligrams, which is what is closest to 100. What is important is to know what is the toxic level of paracetamol, and the toxicity of paracetamol in children is seen at 150 milligram per kg per day and above. So it's very important to keep the dosage much below 100 to be on the safe side. However, again, remember that you should be careful if this child has got concurrent viral infection which is affecting the liver. So you need to be much more careful and try to keep it at a lower dose, as what Madam mentioned, at around about maybe 75 milligram per kg per day, and that should be fine. So it's always a balance between getting antipyresis versus toxicity. And to look at that, the recommendation is don't exceed 15 milligram per kg per dose, and don't exceed four to six doses in 24 hours. So this is what you need to keep in mind. Again, very important, please don't confuse syrups with drops, because the strength is very different. So in our country, we don't have luckily chewable tablets so easily available. So what is really available are drops and syrups. So, and again, the strength of syrup is important, so that you tell the parent what is the correct dose to be given. So I think it's very important to know the maximum dose and to be well below that, and achieve both antipyresis and analgesia.
And very important point which you have mentioned, sir, that in viral infections, we should not exceed the dose, because many a times they will land up with acute liver problems like Ray's syndrome. So this is an important point to be noted. So can we have the answers being displayed? So only 22% have got it correct, and the maximum thought it was choice C. So let us see who got it the fastest. So Bishwadeep Das, he took 5 seconds to answer. I think it was a little confusing, because usually we talk about 10 to 15 milligram per kg per dose. So congratulations, Dr. Bishwadeep. And can we move to the next question, please? The treatment of choice in acquired toxoplasmosis is A, spiramycin, B, sulfadoxin, C, pyrimethamine, or D, combination of the above. Your time starts now. So let us look at what is the correct answer for this question. So the correct answer is combination of the above. That means a combination of spiramycin, sulfadoxin, and pyrimethamine. Though pyrimethamine is said to be the most effective, but we can also give spiramycin and sulfadoxin. Sir, would you like to comment on how commonly you see toxoplasmosis these days?
Not common, but it's seen. And the problem with toxoplasmosis is getting rid of it is very, very difficult, especially when the toxoplasma is in the eye or in the CNS. So therefore, you need to give a combination of all drugs to see how best you can keep the disease under control and hopefully eradicate the disease. Yeah. So it's a difficult disease. It's not very easy to eradicate, but it's very important to use all the possible instruments in your hand to get rid of
so that it acts by various mechanisms and eliminates the organism. So let us see on how many people have got it correct. Okay, 45% of the students think that it is a combination, which is very good. And who has been the fastest is answering this? So Dr. Sudeshna Datta, and she replied in 3 seconds. Very nice. So I think though rare, but we must have this condition, in our minds whenever we think of torch infections. So next, let us go to the next question. All of the following drugs cause fever except, so you have to answer which doesn't cause fever. A, cephalosporins, B, quinidine, C, phenytoin, and D, celecoxib. So your time starts now. as we had already discussed about drug fever, and we have mentioned that anticonvulsants and antibiotics are the commonest. So let us see which is the correct answer here. So it is celecoxib because this is an anti-inflammatory agent. So it will reduce fever. So are we allowed to use celecoxib in pediatrics? I haven't used, and I think it is
no. Maybe rarely in adolescents, but not in older adolescents, but not in children for sure.
Because,
in fact, I think even in many countries, this drug has been taken off the market for various complications, especially associated malignancies. So I think it's
and some cardiac arrhythmias, I think.
Cardiac arrhythmias too. True.
Cardiac arrhythmias also. So this celecoxib, is an anti-inflammatory agent. So I think people should get this correct. Let us see how many of them have got it correct. Can you please display the answers? This was a very popular drug for arthritis once upon a time. And orthopedic surgeons were using it very frequently. So 69% of the people know what celecoxib is. So this is good, and but don't use it because it is not recommended. So let us see who was the fastest in answering this question. I remember, sir, a few years back, around 10 years back, celecoxib used to be the in thing. So, okay, we have Boina Mahesh, who's taken 4 seconds to answer this. So, good. So, can we go to the question number 18? So, 11-year-old boy presented with a 2-year history of recurrent fever with irregular periodicity, intermittent periumbilical abdominal pain, and urticarial rash. Child also had history of migratory myalgia with overlying erythematous rashes and recurrent conjunctivitis. So what is the condition we are talking about? A, tumor necrosis factor receptor associated periodic syndrome, commonly known as TRAPS. B, Behçet's disease. C, PFAPA syndrome. D, Muckle-Wells syndrome. Your time starts now. Okay, so I think the history in this patient was very, very important. Let us look at what is the correct answer. Could you please display the correct answer? So this is something known as tumor necrosis factor receptor associated periodic syndrome, or TRAPS, which is increasingly being diagnosed these days. And you have to understand that this is a chronic fever, recurrent fever occurring with a lot of other systemic manifestations, including myalgia and rashes and conjunctivitis. So this is a very rare kind of a disorder which occurs because of a genetic defect in the tumor necrosis factor receptor gene. And this is something which is being increasingly recognized nowadays, particularly in those patients who come with recurrent fever, and because we have the availability of genetics to tell us the exact genetic defect which has occurred. So I haven't diagnosed any such case as of now, but I have heard of my rheumatologic colleagues, especially in Bangalore and elsewhere, where they have diagnosed such cases. So have you had the opportunity to see?
So in our hospital, we have a specialized unit which is looking at primarily the autoinflammatory disorders. And when you look at them, the distinguishing factor for TRAPS is that it involves multiple systems. You can look here that this patient has got rashes, myalgia, so the skin, muscle, conjunctiva, abdominal pain, fever, all come, and the other thing is irregular periodicity. So basically, this TNF-related, periodic fever is a little different from the others. For example, in PFAPA, you will probably get periodic fevers along with lymphadenitis and sore throat and things like that. And there the treatment is steroid or tonsillectomy. So we have different manifestations of this autoinflammatory disorders which come with recurrent fever, which are non-infectious in nature.
So this is something, if you can diagnose, actually you can offer them some kind of a definitive therapy or advice, because otherwise it becomes very frustrating for both the physician as well as the parents. So can we see how many of them have got it correct? So 36% people have got it correct. And they've also thought about the other conditions, which is good, which means the awareness of other autoinflammatory diseases is also there among the students. So let us look at who has got it the fastest this time. So Abhishek Jaiswal, good, congratulations. You took 6 seconds to answer that. So can we go to the question number 19, the penultimate question? So 8-year-old girl presented with recurrent fever with chills, malaise, abdominal pain, diarrhea, vomiting and arthralgia during fever. On examination, she had painful cervical lymphadenopathy, a diffuse maculopapular rash, and small aphthous ulcers. And the investigation showed high inflammatory markers with an elevated IgD. So which is the condition we are talking about, the enzyme which is responsible for this condition? A, mevalonate kinase, B, pyruvate kinase, C, HMG-CoA lyase, and pantothenate kinase. Your time starts now. So again, I think another chronic condition lasting for a very long time with multi-system involvement. So let us look at what is the correct answer. So here, this is because of deficiency of mevalonate kinase. Mevalonate kinase is actually required for cholesterol synthesis, and this is again one of the rare genetic disorders of autoinflammatory disorders. So I think again the hallmark is that you have multiple episodes of fever with multi-system involvement, especially with abdominal pain, diarrhea, and vomiting. So anything you want to add for this? It's a very rare condition.
Yeah, rare condition. So I think the important thing again here is that this is one of the again periodic fever syndromes, and primarily due to hyper IgD and here. And I have no experience in managing such patients, but I've only read in papers regarding this.
Yeah, even me, no experience. They say there is an abnormality of the innate immune system. So therefore you get so much of, involvement and fever. So can we have the answers, please, if they are ready? So 22% have got it correct, and most of them thought of some other enzyme defects. I don't blame them, sir, because this is really difficult. So
this is to see who is going to really make it to the finals. Huh?
Yes, but one thing is good, at least they'll become aware that such conditions do exist. Yeah. Let us look at who got it the fastest. So Irish Shangney got it correct at 6 seconds. If it was me, I would have just done any, mini, miny, mo and done it, sir. I would not have been able to understand what I'm talking about or answering about. But anyway, and I think the pattern of answers we got, I have a feeling the students are also doing that. But anyway, this is good. So let us go to the final question for this fever quiz.
Either you have be knowledgeable or lucky, one of the two.
Yes, either of them. Oh, this is nice. We got a picture here. So look at the picture carefully and you identify the lesion which is there. A, herpes oral lesions. B, oral candidiasis. C, aphthous ulcer. D, Koplik spots. So do you want me to show them the lesion, or I think it's visible, no?
Visible.
Visible, yeah. So look at the lesion and your time starts now. So I hope everybody could see the lesions. I'll show them now here. And this is something which was taught as a classical finding. And let us look at the correct answer. Please, can you display the correct answer? So these are Koplik spots. And I remember our teachers used to always say that, you look for it, and you'll make a diagnosis even before the rash appears. So this is very pathognomic of measles. I haven't seen them for a long time now, sir. I think our vaccination program is very good, so we never see these patients.
Yeah, and what is odd about this picture is that this is in a very much older child, and therefore it's probably somebody who has not been vaccinated in infancy, or the vaccine has not taken up during infancy. That may be the reason, because this child already has and also has significant caries. So obviously this seems to be somebody who's older and missed the vaccination.
Yeah. So let us see if I think people should get it correct. Let's see how many got it correct. 90%, sir. They know this. Good. So let us see who is the fastest. So Anirudh nearly took 2 seconds. Great. So I think that brings us to the end of our 20 questions for the Fever Foundation quiz for pediatrics for the Eastern region. And we would request our IT section to at least let us know if there is a winner, or we need to do 3 more questions. Sir, what do you say?
I go for clear winners. I think we'll have clear winners here.
Clear winners, right? You can stop displaying this. Yeah. So Manjula, madam, it was okay. I think it was.
Ma'am, extremely good. The way students answered, and wonderful, the enthusiasm, the speed which it shows they had come so well prepared, and you were asking all difficult and confusing, and then made them really tough for them, I think. But still, they could answer 3, 4
seconds.
I think longest answer, if I remember correct, 6 seconds. It was longest is 6 seconds only, not much. So let's hope we have the clear winner. Jagdish sir, what do you say?
I think with Dr. Rashna there, we
on the way, Madam, thanks to you all in the Eastern region, wonderful participation, and then very quick, and percentage you could also see were answering rightly if you had seen the bar diagram. So many of the questions, majority were right, except few.
Nobody is a winner. They're a winner. At least they've got some knowledge from this. What do you say, Dr. Jagdish, sir?
Yes, I think the important thing is participation, not winning.
And so many things came out.
So we enjoyed ourselves, and I mean, doing this quiz, because it takes you back to your student days,
Yes, and it's a relaxation for us, actually.
Absolutely. So
and both of you were explaining each question so very well. It was more
Yeah,
Yeah,
I'm just
Me also.
waiting for the final thing to happen. I'm very excited, and
eagerly
it's
awaiting
really great.
for the, eagerly awaiting to see what is the
Exactly.
political outcome of the
I,
in zone.
Yes.
I got some
Correct.
people from Mizoram, some DNB students also to participate, though they were not on your list, no? So I think they've also joined. So most of the states from Eastern region have joined. How many did
Yes,
we
ma'am.
have total registrations, Abira? You didn't show.
So that is total registration where it's 267.
From the East.
So from East Zone 237. Sorry.
Okay.
So total 125 have attended today's quiz. So it's really great.
Not
So,
bad.
yeah.
Because initially the registration was only stuck at somewhere around 90 or something, no?
Correct.
Last few days, I think it went up.
Yeah, absolutely.
So computer G is taking too much time, yeah.
Too much time.
Computer G is having old lap computer, I think.
The speed of the computer is
Yeah.
low.
So can we have all are eagerly waiting? You are keeping us on tender hooks. Please, can you tell us quickly the names of the winners, please? So they are going to consolidate all, and the winners will be fastest right answer and then maximum such answer. So that is how they are calculating, sir. They have to be fastest also, and they have to be answering more number of questions. And I just want to tell the computer, Abira, can you show me the poster? I want to tell all the participants that
Right.
we are having another event for Fever Foundation after this, which is case presentation competition, where we will be having, like last year, many of you have participated in the to the FEFCON conference, which is going to be 5th and 6th. Before that, we are having a competition for the fever case. Your case has to be in and around fever, and then all it will be sent to your department's HOD for this, and this all the rules and regulations are there, and then it will be sent to your registered email ID for the whoever has registered for the quiz will be sent for the link to upload the case, and the poster should be composed of only one single slide of PPT of 16:9 ratio, and it should contest only one, so that then it will be easier. And then our group of doctors, our eminent panel, will evaluate all the posters, and they're going to call 10 top posters across India for making the presentation, and they will be going to decide the winners. And all the guidelines and the template of the PPT can be downloaded from the link that will be sent to you by mail ID. So kindly look for some very interesting cases, and then please submit your case, and you will be definitely assured of a very, very exciting prize for all the winners, and all the participants will be getting a participation certificate also. And then next also, I think is if it is ready, we can stop this. Otherwise, I can continue. And also, I think I made it clear, the poster presentation part. And today's winner, I want to also tell the participants, will be coming to Bangalore as a team. We are taking 2 winners from each of the zone, and then 8 people, that means 4 teams will be coming. In the November FEFCON, you will be participating as a team, not as an individual. So winner from the East zone, 2 candidate, 2 doctors, 2 postgraduate students will be coming to Bangalore to play the All India final competition. There you will be playing as a team member, 2 member team. So you will be competing with other zone 2 people. So this is how the quiz has been planned. Can we have the final?
Yeah, ma'am. Can we discuss about the guidelines as well for the quiz? I have the second.
Yeah, please show. Please show. Yeah,
right,
please
ma'am. So
Little increase the display. The font size is too small. Yeah.
1 second.
Or full screen. Karna.
Yeah, just a second. So is it visible?
Okay. Right. See the guidelines for all the virtual poster competition while the IT people are working on the results. Right. We are only accepting the poster in the electronic poster only. E-posters is the PowerPoint, the format which has been attached, not the printed poster nor the photograph of the printed posters. It has to be in the PPT only, and the topic should not be should be related to fever, but no other things in and around fever only, and it can be research paper or case based. And category of the participation, you select from the when you click the link, there are link available, whether it's a case study or the original research paper, so you can select from any of the option. So only the first author will be allowed to present the paper, and the poster should be submitted in the template which we have given, and the word limit for the title is 15. It should be only 15 words in the title, and along with the single PPT you need to also submit a word format of a summary of this case, which is about maximum of 500 words, and it has to be in the format of IAP, official journal of IAP, the Indian Pediatric for the pediatrician, and JAPI it's for adults anyway. The acceptance of the poster will be entirely by our scientific committee, and their decision is final on everybody, and it's a binding thing. And for further any queries you have, kindly mail to us on feverfoundation@gmail.com. Any queries on the poster presentation, you can mail it to us. And all posters are exhibited during the FEFCON conference on the poster presentation hall, which will be on the virtual platform. Though there are physical, it will be hybrid kind of a conference which you are planning in FEFCON. So we are inviting the winners to the Bangalore, and then all the posters, other participant posters will be available on the virtual platform. So the link is given below, and you will be getting this link to your registered email ID, so that you can download and go to the link and download the PPT itself for using it as your template. So that's about the poster presentation competition, and this will happen after this quiz is over. You will have sufficient time to prepare and poster. I think the last date, as the committee has told, that it should be on, I think 16th of October is the last date for. Yes, Abira, can you show that? We will have the last day as October 16th for
16th, yeah.
16th of October as
16th
the
October.
last day for submission of your posters.
Right.
So kindly look into all your cases, and then interesting cases or any of your research activity on the fever, you can submit it.
Ma'am, I think we are all set.
All set, is it?
Yeah, we are all set.
Sir, Dr.
So-
Jagdish sir and Rachna ma'am,
I
yeah.
was sleep.
Eagerly awaiting, eagerly awaiting.
So
Right. Abira, you want to say anything for the Eastern region? Anything on the from your point of view?
yeah, ma'am.
The poster registration, your team will go, right? You go to the each of
So
the
they
hospital.
will go and they will print the guidelines. They will definitely guide you how to upload the template, and you will be getting a separate link for uploading the poster. So the template will be there. So you have to upload that particular template and the specific size as well. So our team will definitely help you.
I also want to tell you all, I got a lot of queries from you all on the student certificate. So this is to why we prove that because these are all only for postgraduate students. So you can take that letter from your HOD that you are the postgraduate studying, and it is also required. This attachment is also required for submitting the posters. So therefore, kindly same attachments which you had used for student certificate can be used here also for the poster. This is to only to giving a proof that you are a postgraduate student. So that's it. So that's how it is.
Yeah. So we are ready to share the winners. I'm requesting team. Yeah. So we are eagerly waiting for the names of the winners.
Oh.
Oh, wow. So,
Congrats.
Anirudh Nili from AIMS Bhubaneswar. Congratulations. And Dr. Naveen Kumar from Darbhanga Medical College. Sir, I think they've done excellent.
Yes, absolutely. Fabulous. And I think
yeah, Dr. Anirudh. Yes, sir.
I think all the students did well. I think we had very good answers. So I don't think there's much to differentiate. But congratulations to Anirudh and Naveen. And I think hope to see you in Bangalore soon.
Yeah, Dr. Anirudh and Dr. Naveen, our team will get in touch with you, and both of you will be playing as a team. Kindly, we will share each other your phone number, so you coordinate with both of you and make as a good team, and then you will be competing with the similar teams across India. So wishing you all the best for the national finals. Congratulations once again to both of you and to all the participants who did wonderful job. And as our judges are saying, that each one was a winner, and since we need to take the right, ma'am.
Yes, absolutely. I think all of them did very well.
Yeah. So applause to all of you. Congratulations. Sir, Jagdish sir and Ashna ma'am, I think can we?
Yeah, we can log off now.
Log off. I request all the participants also log off, and thank you very much.
Thank you to Microlab team for your
recording stopped.
Bye, sir.
I think
Ma'am, sir, thank you very much, sir.
We should.
Extremely good it was. I was asking Mr.